So what is up guys, Medico Mishra here and welcome back to another dose. And today we'll discuss about the black fungus, white fungus and yellow fungus as well. And we'll know the reason, what is the reason behind the development of the fungus. Because as these fungus are not new, but we'll have to understand why these fungus are growing so fast and rapidly in the COVID patient and the patient who are recently recovered from the COVID. So we'll understand all thing and whole scenario, what's actually the thing is and what we have to do and how we can prevent it and how we can treat it. So basically we need to know what is the main reason behind the development of the fungus. The first of all reason of developing black fungus is, and any fungus in fungal infection which are developing right now, the main reason is the weak immunity. And what is the reason for the weak immunity? It is the overuse of the corticosteroids in COVID patients. And why steroids are used? Because this COVID is causing some inflammation in the lungs, and just to remove that inflammation, doctors are using just corticosteroids. And in worst scenario is like excess amount of the corticosteroids is causing weak immunity, because corticosteroid inhibit the inflammatory mediators as well. It is cytotoxic to the immune cell as well. So that's why immunity gets weaker and you are easily prone to any infection, such as this black fungus is getting serious issue nowadays. Even white fungus came and yellow fungus is now another infection which developed. So we'll talk about this now. So firstly we'll discuss about the mucormycosis, which is also known as black fungus, and which is caused by the group of molds. Like it is a fungal infection caused by the group of molds, and mostly it affects the people with weak immunity and the immunocompromised patients, such as like patient with cancer or diabetic patient or patient with HIV and autoimmune disorder patient. So it affects them mostly. And also it represents with the symptoms such as cough, fever, headache or nasal congestion or pain in sinus. It is, and also there is some unique feature which you can identify easily, like it can cause black lesions on face as well. It can cause black lesion in eyes as well, because it can spread to eyes, lungs, brain or face as well. And the another unique feature you can identify black fungus with it is sinus pain. Like it can cause pain in your sinus areas, such as this. There are, here we have the sinus areas, so it can cause pain in them as well. And now coming to the diagnosis, it can be diagnosed by the biopsy, nasal discharge and the CT scan. Now coming to the treatment, which is antifungal medication or the vaccines we can use, such as amphotericin B, which is a IV injection, or posaconazole, which is IV injection as well as tablet, and also isavuconazole, which is also IV injection and oral medication. And before taking any of these medication you should consult with your doctor as well, because doctor will take care of your like any kind of reaction or any kind of allergies you have. So doctor will take all the like doctor will prescribe you according to him which will be better for you. So I can just tell you the medicine, rest you must take the recommendation with your doctor as well. And secondly, coming to the white fungus, which is also known as Candidiasis, and which is also present like COVID like symptoms and increase the severity in the COVID symptoms. And it will also test negative in the PCR, but it can be diagnosed by the fungal culture and the CT and X-ray. And it can also affect lungs, nails and the stomach and kidney, brain and private parts and the mouth. And coming to the reason why it happens, like why it infects, the reason is weak immunity and the immunocompromised patients. In them, it can affect very easily. And also, we can see some symptoms like an unexplained feeling of weakness. And also, it can have some aspergillus infection symptoms, such as blood in the sputum or the difficulty breathing or chest or joint pain. We can see in that. And also, we can see unexplained weight loss, and also night sweats we can see in this, because it can present symptoms like aspergillus infection as well. And coming to the treatment, and the treatment is antifungal medications which are clotrimazole and the neastine, fluconazole, and the amphotericin B. Uh, you can find clotrimazole as ointment or fluconazole as some capsule, or amphotericin B is vaccine I told you earlier as well. And thirdly, coming to the yellow fungus, which is recently came like 2-3 days back, and it is also caused by inhalation of the molds from the environment, and also it is caused by the contaminated food, unsanitary conditions, and overuse of steroid medication, and the weak immunity and immunocompression. And this infection is not contagious, it don't spread with person to person, and it affects person in a different manner, because it affects internal organs of the body and disturbs the vital functions of the organs. And it presents symptoms like pus leakage, slow healing of the wounds, and the lethargy. Lethargy means like it affects on your main organs like such as heart and the kidneys, and it will make you feel exhausted. That is lethargy. And loss of appetite will be there, and poor eating habits or weight loss it will be there, and poor metabolism. Shrunken eyes will be there, and in severe case you can see necrosis as well. And in this case treatment we can use amphotericin B as vaccine, which is IV, and also we can use other medications which are more potent than amphotericin B, and they must be antifungal medicines. And guys, before taking any sort of medication at your own, just go to your doctor and consult with your doctor, like these are the medication or any medication doctor will recommend, or doctor will tell you that which medication is best for you, and like doctor will observe your condition and he will tell you the best recommendation for you. So don't take medication at your own. So guys, if you like the video, please do like, share, comment, and subscribe to my channel. Thank you.